Dear students, very good afternoon. In last lecture, we have discussed about the role of pharmacy and therapeutic committee in the development of essential drug lists. In that, we have seen which are the medicines or the drugs along with all the necessity articles to be maintained, and next point we have also discussed was the role of this PTC in drug product defect reporting. We have seen the format, how the reporting can be done if any defect has been detected in the products purchased by the hospital. Now, the last point of this topic, role of pharmacy and therapeutic committee in drug utilization review. Drug utilization review actually includes prescribing, dispensing, administering, and ingesting the prescription of the drugs. Now, when we say all these things are very important, everything is related with the drug, how it has been utilized, how it has been used by the patients in the hospital. So, in this review, everything regarding the use of medicine in the hospital has been covered. Okay, this is also very important function of the committee in the hospital, along with the earlier what we have discussed. Hospital pharmacist should take the medication history of the patients in regard with many things actually, like the medication being taken by the patient at the time of admission, along with the medication taken during a recent past, also include the antibiotics in it. Then if any OTC products, home remedies, if they have used, that has to be noted down, whether the patient is having any drug allergies, it has to be noted. Then along with that, any sort of idiosyncrasy towards the food products has to be noted. Idiosyncrasy means the abnormal physical reaction by the patient's body or that by that individual towards the medicine. Here you can say food products. What are the physical changes that are called as idiosyncrasy? Along with that, we have to also note the laboratory tests, the diagnostic tests or parameter which were performed on the patient out of the hospital, during which what were the diagnostic agents which are used. Okay, so these many things are a sort of information to be obtained from the uh, patient, along with the personal identification. Okay, along with the general diagnosis which is they said. Okay, these all things are to be noted, and this medical history we know are taken by the pharmacist of of whom every patient which is admitted to the hospital as well as the patient which are seen in the ambulatory care section. In both sort, that is outpatient department as well as inpatient department, the patients who are there, their medical histories are needed to be noted down. Okay, and it can be done by either personal interview of the patient, or it can also be taken down via the computerized questionnaires which are specifically designed for getting such information from the patient. Okay, you can individually ask the patient the questions about these things. Okay, or you can have a computerized system in which you can get such information, detailed information. Then we are having a specific form, okay, which gives the patient medication profile, and it is to be maintained for every patient. Okay, and let us see what that form includes. Easy format again. Name of patient. See, at the top you can see the name of hospital, then patient medication profile. Okay, record number, what if it is, name of patient, age, sex, then address of the patient, date of admission in the hospital, then what are the diagnosis at the time of admission, which is called as admission diagnosis, and other pathological symptoms or what diagnostic test you have been done. Okay, then pre-operative medications, if any, used by the patient. So there is a specific table by which you can note down about this. Okay, which includes the date, the drugs, the medicines, their doses, the route of administration mentioned, the time or the date it has been started to administer the drug, and when it has been discontinued or stopped, okay, after feeling well, or even if not got the result, whatever it may be, and any specific remark about the same information you have rendered or obtained from the patient. So this is a simple format in which you get the patient medication profile. Okay, then uh, this information which has been taken down, it serves many purposes. Okay, why you are doing this? Actually, it helps to improve the drug prescribing practices. Okay, drug prescribing practices means which drug is to be mentioned in the prescription by the physician. Okay, it is improved a lot if you are having regular review of this utilization, how which medicine generally has been used by the patient regularly. Definitely it is becoming easy to improve the prescribing practice of that medicine. Okay, and can do it by promoting the safe and effective or rational use of the drugs. Okay, definitely it is going to help the pharmacist as well as physicians. Then it helps to prevent a drug interaction also. Okay, because you know for what drug or which drugs are used by which patient. So depending upon that, by the knowledge possessed by the pharmacist as well as the physician, they can avoid uh, keeping this two drugs which are having this sort of interaction with one another. Okay, then to help to detect as well as prevent the adverse drug reaction. Okay, because this is also thing very important one, adverse drug reaction, we have seen it in detail. Okay, so if you are collecting the proper information about the drug utilization review, you will be able to do the proper detection of adverse reaction as well as avoiding it to happen with the patient. Further, it also the other purposes of this are to detect and prevent IV additive incompatibilities. Incompatibilities are there with many of the intravenous additive which are there. Okay, and what form just we have seen, it is going to help the pharmacists and physicians for doing it. Then to detect the drug induced diseases. See, important one, some diseases which are induced by the drugs, because if one patient is taking medicine for we say first disease, okay, and by that medicine there are chances the same medicine induces second disease in the patient. So if we are regularly monitoring the uses of medicine by the patient for first disease, you can detect the another problems which are occurring due to the same medicine. Okay, that is drug induced diseases can be detected. Then it will help to detect and uh, find out what are different toxicities which are there, which occur by the use of the medicines. Okay, whatever potential drug toxicities are there, okay, they can be detected by this sort of review, which is generally done and needed to be done by every pharmacy and therapeutic committee and its member, importantly physicians and pharmacists. Further, the drug use review or patient care audits, which are nearly same thing. Okay, the short form of drug utilization review (DUR) can be used many times, which can be defined in detail actually as an authorized, structured, ongoing review. Okay, see, this review is an authorized procedure. Okay, drug utilization under observation of pharmacist, physician, or medical authorities of the hospitals which are there. Okay, they are doing it, and again it is structured, means a systematic review is done for the use of medicine, and again ongoing means continuously the review is done. And for what the review is done? The review of, just we also prescribing, dispensing, and actual use of the medicine. Okay, this is called as drug utilization review. DUR includes everything. Okay, further, this also includes review against predetermined criteria that results in changes to drug therapy when the criterias are actually not met. Because if during the observation, okay, during the review process, if the prescriber or even the pharmacist have observed that their criteria, depending upon their criteria, or you can say the actual proper utilization of the medicine, if not there, okay, means whether it is properly followed or not, it is included in the drug review definitely. Okay, drug utilization review. Okay, then this also involves the uh, complete review of patient's prescription and medication data. Just I told the prescription data which is there, okay, before, during, and after dispensing, it is also done. Uh, for what it has, this data has to be collected, okay, just to ensure the appropriate or correct medication decision making. Okay, if you are taking the detailed information of the patient about the use of medication, you will be only then only you will be able to make a proper decision regarding what drug is to be administered or mentioned in the prescription. Okay, and ultimately you are going to get a positive patient outcome, means you will come to know which drug are effective for that patient, which may form some problem. Okay, all the things just we have discussed, all these things can be known, and ultimately you will be able to give a proper care or treatment to the patient, which is called as positive patient outcome is possible. Okay, as a quality assurance measure, this drug utilization review program actually provides the corrective action as well as the prescriber feedbacks and further evaluation. So these things are possible with this drug utilization review, because you are able to make correction in the prescription or the habit of writing the medicine in the prescription. If they are having problem, you can replace with another drugs, okay, for the same category of disease. Then you can also definitely get the feedback from the prescriber. The prescriber can come to know how what problem are there, means the physician, if he is prescribing, okay, he come to know what are the actual review. Okay, review means what is the proper outcome of the everything, that is prescription, utilization, everything about the medicine which is used by the patients, and ultimately you can evaluate where the problem, if any, and how to overcome that problem. Okay, this drug information review can be either a freestanding activity or be incorporated in the current patient care audit which is which are audits, you know. Okay, current patient audits means regularly you are getting the information from the patients. It can be there, or freestanding activities separately you can get the information. Patient care audits actually use the detailed information of the patient collected, and whatever data you are getting from such observation, they can be used or applied to a sufficiently large number of patient records. Okay, for what you can do it, just to have a proper evaluation of the quality care being provided for a specific disease or a specific surgery you are going to perform. So what we can say is the drug use or drug utilization is often an important component. Okay, it is inseparable component of the patient care which is to be provided, and hence it should be appropriately reviewed. Means the review should be done in a proper way, okay, by following a standard operating procedure. Okay, now that a drug utilization review can be performed in different ways, okay, and dependingly or accordingly it has been categorized in three forms. First, you can go for perspective, secondly concurrent, and third retrospective. Perspective means the evaluation of patient's drug safety, okay, before medication is dispensed. That is prospective, you are doing it in this format. Then concurrent means what are actually the medicines which are taken. Okay, you have to monitor the drug therapy which is going on during the treatment, which is called as course of treatment. Concurrent. And retrospectively means the drug review which is you are doing of that therapy after getting the medicine or after the administration of the medicine. Okay, retrospectively it can be done. So this review can be of these three different types. Okay, then nextly, drug utilization review program actually plays a important or key role in helping the managed healthcare systems which are there. Okay, all the healthcare system is ultimately the hospitals and their management organization for different things, like they understand, interpret, evaluate, and improve the things regarding this prescribing, administration, and actual use of medicine. Okay, if drug utilization review is done properly, then only you can uh, have the proper knowledge of understanding the how prescribing can be done, okay, or how it is regularly done by the physician in that particular hospital, how you will be doing a proper administration, okay, and actual you can have a proper evaluation of the medication use. Okay, ultimately you can have a improvement in your patient care, which is the prime important consideration when we say about the hospitals. And lastly, what we can say, pharmacists play a key role in this process. Okay, key role because of the knowledge which is there, which is that pharmacist has been achieved or acquired during the degrees or during their courses, along with the experience in the area of medication therapy management. See, what information we get about the medicine during our degree, or if you say in B Pharmacy, if is what we are studying is the theoretical aspects of the medicine. But when we get the information after performing a role as a hospital pharmacist, you can then only uh, understand how the management of medicines is to be done. Management by the sense how it should be utilized effectively in the hospitals. Utilization includes everything just we have studied. Okay, hence the knowledge possessed by the pharmacist is very useful over here in this regard. Okay, hence again at the last, for pharmacy and therapeutic committee, the thing we can say is it is the backbone of the hospital pharmacy and its services. Definitely backbone means what? Every aspect, okay, every work, whatever has been done in the hospital ultimately is known to the pharmacist. He is working in the hospital. He is inseparable part of that process. He is involved in the patient care. Okay, that pharmacist, who is again the member, important member of this pharmacy and therapeutic committee, is involved in management and administration of the hospital. Hence, ultimately, we can call the pharmacy and therapeutic committee as a backbone of the hospital pharmacy and all the services which are provided or are given in the hospital pharmacy. And hence, further, we can add to this, if it is important or if it is a backbone, okay, it should be properly organized, like what what care we are taking about our back. Okay, we should sit properly, we should sleep properly. Similarly, if we pharmacy and therapeutic committee is said to be backbone of the hospital pharmacy, their organization means it should be properly grouped. The personnel which are working in the hospital pharmacy should be allotted properly with the functions they have to perform, and subcommittees should be formed correctly, and all the role which we have seen, okay, uh, about everything, from reversely, if we'll say drug utilization review, okay, drug product defect reporting, preparation and development of drug emergency list, then automatic stop order for dangerous drugs. So these all the roles what they are doing, okay, should be properly organized, and then only you can say the hospital pharmacy will be able to give its 100% towards the patient care, and ultimately the hospital will have the success in the same, okay, patient care, and ultimately the name, fame, that is image of the hospital will be improved. So pharmacy and therapeutic committee is completed over here. If you are having any problem in regard with this topic, you can contact individually to me. Thank you. Take care. Bye.